Do you know someone with a long-lasting cough, weight loss, or night sweats but they keep ignoring it? That could be tuberculosis, and some common habits make this infection far more dangerous for families and communities. TB is caused by bacteria that usually attack the lungs, spreads when a person with active TB coughs, speaks, or sneezes, and can be cured with the right treatment taken fully. What is TB and who is at risk? Main symptoms: cough lasting more than 2 to 3 weeks, chest pain, coughing, blood, fever, night sweats, fatigue, weight loss, and loss of appetite. High-risk groups: people living with someone who has active TB, those in crowded or poorly ventilated places, people with HIV, diabetes, malnutrition, or weakened immunity, and those in or from countries with high TB rates. TB mistakes and risk behaviors: you must avoid ignoring a long-lasting cough and other symptoms. Many people keep working or traveling with a cough that lasts weeks, weight loss or night sweats, delaying diagnosis and spreading TB. Any cough over 2 to 3 weeks, especially with fever or weight loss, needs medical testing for TB. Early diagnosis protects both patient and family. Stopping TB medicines early or skipping doses. Not taking TB medicines exactly as prescribed or stopping when feeling better can cause treatment failure, relapse, and drug-resistant TB that is much harder to cure. That completing the full course, even for many months, is crucial to kill all bacteria and protect the community. Staying in crowded, poorly ventilated spaces without precautions. TB spreads easily in crowded, closed environments such as slums, hostels, prisons, shelters, and poorly ventilated workplaces. Improving airflow by opening windows and doors where possible. Avoiding unnecessary time in packed, unventilated rooms, and advocating for better ventilation at work and home. Close unprotected contact with someone who has infectious TB. Living or working closely with a person with untreated active TB without masks or distancing raises infection risk, especially for children and elders. Contagious TB should stay home. Avoid crowded public transport or gatherings. Wear a mask and follow isolation guidance until doctors say they are no longer infectious. Poor cough etiquette and lack of basic respiratory hygiene. Coughing or sneezing into the air or hands without covering spreads TB bacteria widely. Covering mouth and nose with a tissue or elbow, safe disposal of tissues, and frequent hand washing with soap or using sanitizer. Ignoring nutrition, sleep, and general health. Malnutrition, chronic stress, and very poor general health weaken immunity, making latent TB more likely to become active disease. Nutritious diet with enough protein, fruits and vegetables, regular light exercise as tolerated, and adequate sleep to support the body during and after TB treatment. Not testing or treating high-risk people for latent TB. People with latent TB infection, TB germs, sleeping in the body may develop active disease later, especially if they have HIV, diabetes, or other immune problems. Stressed that those with known exposure or in high-risk groups should discuss TB testing and preventive treatment with their doctor, even if they feel well. Stigma, secrecy, and lack of support. Hiding a TB diagnosis out of fear or shame can delay care for close contacts and isolate patients emotionally. Families to support patients with kindness, remind them to take medicines, help with clinic visits, and understand that TB is treatable and not a curse. If this video gave you clarity or hope, please like this video, share it with families who need this information, and subscribe to Medickpidia for more science-based, heartwarming health content. Together, let's turn awareness into protection and protection into hope for every TB patient and every family.